Okay, go for it. Begin.
And good evening, everyone. Welcome to our fourth or fifth webcast. My name is Rick Ward. I'm one of the physicians here at Crowfoot Village Family Practice. And it is very cool to be able to, once again, be joining many of our patients to talk about where we are in the world with COVID. It's definitely a very topical issue. We have got close to 1,500 people that are joining us today, and more that will be viewing this video in the next couple of days. So I'm just going to present some introductory slides just to get us going. And of course, the sub-theme is a COVID Christmas, not one that any of us wanted to have. Next slide, Trevor. So why are we doing this? And really, CVFP, we feel is the medical home for so many of you online. And what we want to do is we want to provide you the most up-to-date, reliable information around what's happening with COVID, and also bring you some health tips and other tips to try and get us through this second wave and this very difficult time that we're all having. So who's who to help me out? I'm simply the cheerleader and the mover around of slides, and we've got really a great group. I call it the COVID Webcast Dream Team. Dr. Jia Hu, who's one of the medical officers of health, Dr. Vanessa Chong, who is one of my AHS colleagues. She's a psychologist who has done incredible work in developing tools for patients to be able to help with stress, anxiety, depression, and resilience, which is something that we all need a lot of. And Dr. Michael Parkins, who is an infectious disease expert, but also the head of infectious disease for the university and AHS. These three individuals have worked with the Calgary Zone family physicians on a regular basis in providing scientific updates, really practical solutions to challenges that we have. And I'm so blessed, we are so blessed that they've taken time on their Wednesday night to be able to join us. Jia Hu is going to be joining us a little bit later, as is Michael Parkins, but put on your seatbelts because we're in for a really great night of learning and information. Next slide, please. Just like any good COVID night in Canada, we've got some color commentators. We've got Corrine Weems, and I don't know whether you can show those lovely faces, Trevor, who's our head nurse here at Crowfoot. There's Jennifer Lamb. Jen, just give a wave, who is one of our key pharmacists, certified diabetes educator, and a great colleague to work with. And we've got the youngsters on board. And the youngsters are Dr. Erin Gore-Hickman, and Erin, who brings a smile to my face, and Dr. Yan Yu, who also give us a smile, and Dr. Ian Johnson. And I did say the youngsters, and I feel like I'm losing credibility before. Yes, I know, and on an earlier podcast, I'd referred to him as Mr. Clean, which for those in my generation was a funny pun, but we'll call him the designated import tonight. Ian, thanks for joining us again. Also on the chat line, we have at the very least Dr. Lynn Gillis and Dr. Karen Richardson, who will be monitoring the chat. This is really meant to be interactive. So on the right-hand side of your video, you'll have the ability to give us input, write questions, give comments, and Karen and Lynn and perhaps some of the others of our Crowfoot team will be able to answer and comment on that. Now, there's just a few slides and comments that I have on etiquette. Yeah, those are our bloggers. Remember that if you're typing a question into the chat, this is not anonymous. So if you want to use this opportunity to maybe ask about your hemorrhoids or this weird rash, not in the chat line. It's all good. But please do put comments and questions. We got lots of questions that came in, and we're going to try to answer most of them, theme them together. Some of the questions we're going to try and get back to you individually because there was some really good specific questions that we think we can answer. And finally, if this is good, you liked it, you want to come back and listen to it again, or there's points that you wanted to follow up in, we'll have a copy of this in our on our CVFP website within the next couple of days. So you can go back and look at the archived information. So let's get started, and we're going to start off really with the topic of mental health and resiliency. And I'd like to ask Erin Gore-Hickman, again, one of our new docs here. Erin, what are you seeing in your practice in terms of the psychological impact of COVID? How are patients being affected by it? And mute.
Perfect. Thanks, Rick. So, I mean, we definitely know that the holidays are a stressful time at the best of times. And so going through a COVID Christmas, I know, is adding this extra layer on top of everything. And so certainly there's been some common themes that I've been seeing with lots of my mental health phone calls in these past few weeks. And so I picked out a couple topics and looking forward to kind of expanding on them with Dr. Vanessa Chong later. So I think one of the first big things I'm seeing is anger and frustration. So particularly with lots of the restrictions that are coming out, keeping up to date with the newer restrictions. You know, I think no one was anticipating this at the start of COVID, thinking back to February and March. And so coming into this now, I think it's taking its toll in terms of feeling that frustration and feeling for how long this has been going on. Another common thing that I've been seeing certainly is sadness in all of this. So, you know, feeling discouraged when we're not able to gather with whomever we want for the holidays. Certainly people with family and long-term care centers, that's something that can get to them. And, you know, people who, you know, don't have the classic sort of or traditional times to now reach out to family, which COVID has impacted. Another common theme, so fear and I think fatigue plays into a little bit of that too. So, you know, the underlying fear of exposure to the virus and you know, having to use that extra brain power to be cautious when you're out and about and maintaining your hand hygiene and wearing your mask and again, keeping up with the recommendations that have been put out for lots of the restrictions here. On the flip side, I think that I like to try and put a positive spin on things still. And so I have heard stories from patients, some of whom are feeling relief, where, you know, they don't have to be cooking a big turkey dinner for 15 people. They don't have to be setting up Christmas decorations in their home. We set them up on the outside just to, you know, enjoy the spirit, but on the inside, they can, you know, keep their home how they would like. And I also hear some gratitude in terms of, you know, within your own household, spending time with each other. And so with things such as, you know, sports being canceled or other group gatherings, spending more time with your kids that you might only have spent time with them, driving them to and fro from their activities. And then I think lastly, just that we live in an age now where we can have Zoom, we can do FaceTime, we have all these options to reach out to each other, to not feel as isolated as we might have, you know, a few years ago. So yeah, I think with that, those are kind of the major emotions that I'm sensing in all of this. And yeah, so I'm looking forward to kind of hearing from Dr. Chong and going from there. Thanks, Rick.
Yeah, thanks, Erin. And I think it's safe to say that just about everyone that I talk to, and myself included, we're all feeling touched by the pandemic and all feeling a little bit uneasy or non-grounded. And that's why we have Dr. Vanessa Chong, who is here to provide us some COVID tips with a Christmas flavor. Vanessa, let's turn it over to you to help us with this challenge.
Thanks, Rick. So hi everybody, my name is Vanessa Chong and I'm a psychologist working at a mental health clinic in the Northeast with Alberta Health Services. And I would definitely agree with what Dr. Gore Hickman has said. I'm seeing all of that in my clinic. I think, even for myself, last night I had to kind of scramble and change my presentation today because things are changing so quickly and we're all just trying to adjust, right? I think it's taken a lot of flexibility this year, and it's kind of a moving target. In that way, it is a little bit different from a regular Christmas where we don't exactly know what's going to be okay and not okay until kind of the last minute. So that's kind of what I'm going to be talking about today. And I think definitely Christmas is already a challenging time of year. I usually actually start talking with my patients about Christmas in November because it tends to be a really tough time. It also tends to be something that people avoid. So a lot of people just don't want to think about it. They procrastinate, and then before they know it, it's Christmas, and it can be more overwhelming at that point. So some of the strategies I'm going to talk about today will hopefully prepare you well. And I don't know this year. I don't think we can perfectly be prepared, but we can try our best. So let me just open my presentation here. Okay. And so I came across this, I took a picture of this in a co-op a few weeks ago, and I thought it was kind of funny because this year we're not wearing ugly Christmas sweaters, we're wearing ugly Christmas sweater masks. And I thought it was kind of a perfect representation of this year. It's the same, but not really. It's the same, but different. And I think it has been a marathon. I think we're tired, and it's, this is kind of the final hurdle for a really kind of challenging year that we've all gone through. So even in normal times, I think Christmas is one of the most stressful times of year. And it's kind of a weird thing because on the surface, Christmas seems like the happiest time of year. And I think that actually is what makes it more difficult, is because we think it's supposed to be happy and peaceful, and usually it's actually not. There's more levels of stress from, financial stressors, the pressure to give gifts and not being sure how we're going to do that. There tends to be a lot of family drama that comes up. People are coming together and spending more time together than normal, and that can cause problems. This year, maybe not as much, right? It tends to be a time when drug and alcohol use goes up. Also eating foods and indulging, and that can be a recipe for disaster for some people. It's also a time when a lot of painful memories come up, and I work a lot with people with PTSD and trauma backgrounds, and so it can actually be a very triggering time of year for some people. There's a lot of reminders of family, or maybe the family you didn't have that you wish you had always had. There's also triggers for grief, so people who you've lost. Weather usually gets worse, although we've been pretty lucky so far this month. Crowds are pretty stressful, maybe less this year. And the social obligation. Then we add on top of that the stressors that come with COVID-19, right? The uncertainty, not being able to follow traditions, and most people don't like change, and this is requiring us to make a lot of adjustments and changes. Traditions are about doing the same thing every year, and so that is an extra challenge for sure. So I would say that the number one thing that I tell my patients is the importance of being proactive, of not avoiding and planning now. If you haven't started planning already, I would say plan now. And part of this is because it's about getting yourself used to the idea of a different Christmas and also getting your family used to that idea. So I think it's really important to have those conversations with your family members about what holiday plans will look like or not look like. Thinking about your own expectations and levels of comfort in light of COVID-19 and clarifying your loved ones' expectations. In one way, the restrictions that came about yesterday make it a little bit more clear because I think there's less decisions to make about contact or no contact. And so in some ways that might be a little bit freeing. There is less room for negotiation. But I would say it probably is not a good idea if you usually celebrate Christmas to avoid it completely and skip it. I have heard a lot of people say that, like, I'm just not going to do Christmas this year. It's probably not a good idea. And especially for those with little ones, having some normalcy and some predictability is really, really important for them because they're feeling the effects of COVID-19 too. And, having some routine, having something to look forward to is important for them too. I think it's really important to keep yourself informed right now. And because things keep changing, it's important to keep yourself up to date on the latest government recommendations and restrictions. I'm not sure if there'll be a copy of my slides available afterwards, but if that's an option, I'll make that available because I have included some links that could be helpful. And I do know, even for myself and for patients I've talked to, that there isn't great clarity for people on what a cohort is. I remember a couple months ago, one of my clients said, "Oh, my cohort's 600 people." And I'm pretty sure that's not the definition of a cohort. So there actually is a really good document from Alberta Health Services, or maybe it's the Alberta government, on what exactly is a cohort, okay? In preparing for this presentation, I also found a really helpful article put together by the CBC. And it actually answers questions like, should we be canceling plans? What if we isolate beforehand? Does that make it okay? If I have a negative test, is that okay? Can I still get presents and cards and cookies? Can I give people presents, cards, and cookies? How do I tell mom in the nursing home that I'm not going to be coming for Christmas? What happens if we just go ahead and don't take the precautions? What happens if we break the rules? So I think it's really helpful to read. People sent these questions in from around the country, and they had experts weigh in and give some really good information. So the first thing to decide is, what are you doing for the holidays? And this might be a little bit difficult to decide. And so I think it tends to be good to write things down. I would recommend doing that and just coming up with a few different options. Weighing the pros and cons of those options, figuring out which pros and which cons carry the most weight, and trying to choose an option. But if that one doesn't work out, at least you have some backups. It often is the case that like a combination of options is helpful. And I think this year, the key is being flexible and being creative. You have to think outside the box because we can't do the things that we would necessarily normally do. The second piece is to come up with a coping plan. So this is something that I'm basically doing with all my patients right now. And again, we write this down. Really important to have that down on paper or in your phone or somewhere like that. And what a coping plan is basically planning for the worst and hoping for the best. It's anticipating ahead of time the worst case scenarios and then figuring out how you're going to deal with that if it does happen. And some of the things you might want to put in a coping plan are, how are you going to deal with difficult people? How are you going to handle difficult comments or questions if you have kind of critical people in your life? How are you going to deal with that? If you know that probably certain family members are going to pressure you into visiting anyway, how are you going to deal with that? The best policy is low and slow. Low and slow meaning now is not the time to bring up any issues that you've been having your whole life with somebody and trying to resolve them. We often think that people are going to be the best versions of themselves at Christmas. It's actually the opposite. So people are going to be the worst versions of themselves at Christmas, and they're going to be the worst versions of themselves this Christmas. It's not a good time to bring those kinds of unfinished business issues up. Okay. Loneliness and isolation is something that does happen. We want to plan for that, especially this year. Setting limits and boundaries, and this isn't just with yourself. Isn't just with others. This is also with yourself. So what I mean by that is setting limits around things like eating, drinking, substance use. It might be around finances, like setting a budget for yourself. Might be around how much you try to get done or do for other people. Dealing with triggers. So if you know that you're going to have some triggers that come up, what are you going to do about that? Managing finances and gift giving, substance use, and planning ahead for self-care, including physical activity, which, as we all know, can be a really important way to manage stress. Also planning for some fun and planning for safety. It's the number one time of the year when we see suicidal thoughts come up. And so we want to just plan, like, what are you going to do in case any of those thoughts happen to come up? So isolation and loneliness is definitely going to be a little bit worse this year with some of the restrictions. I think it's helpful to come up with some ideas now. Don't wait until the day of Christmas to try to figure out what to do. So, I think as was mentioned earlier, we do have Zoom and technology. We have FaceTime. We have lots of ways to connect with loved ones through technology. No, it's not exactly the same, but it's something, and it is a way to connect. Some ideas include a virtual dinner, maybe a games night online, or you could even do carol singing, karaoke online, using some kind of humor. So I thought it would be kind of funny to have a wacky Christmas mask competition where you you get out your arts and crafts skills and you make a mask. Maybe best looking dessert contest. You could have a distanced potluck, so dropping off dishes on each other's doorsteps. So you still get mom's turkey or her traditional cranberry sauce, right? Maybe there's some things that you've always wanted to do that you never got to do because there were traditions and you were obligated to do those things. So this is also a time to maybe try a new tradition, try something that you usually don't have time to do. Okay. It might be especially difficult for the elderly right now. I know for myself, I have my grandmother's in a long-term care facility, and I don't know if I can see her. She doesn't use technology and she's not really savvy that way, even though they offer it in their nursing home. So I think it's really important to address that with loved ones, explain that you're doing this because you care. It's not because you're just being selfish or not thinking of them. And it might be an idea to delay some of your traditions. So I know with My husband's family, we're planning on doing Christmas in June. We might even put the Christmas tree up again. We'll see. And so even though we can't do all those things now, we can do them down the road. Also, this is just one Christmas. We can do this, I'm hoping, fingers crossed, next year. Now with children, like I said earlier, it's really important to have some normalcy, and uncertainty is very scary for kids. So having a conversation with your kids, explaining that it will be different, and trying to brainstorm some ways to still make it a special year to remember, maybe involving the kids in that conversation. And that could be kind of fun for them, right? I think discussing what your family traditions are and finding ways to adjust those traditions, maybe focusing on the values and the meaning of those traditions, and then trying to find activities that maintain that spirit. One example, I found a great website. It's called Lighten Up Calgary, and it actually lists the best neighborhood Christmas light displays. So people can vote, I think, and they list the most extravagant displays in different neighborhoods in the city. And so that might be one way to still do something special for the kids. I think this is also a time to practice assertiveness. I work a lot with people on assertiveness throughout the year, but this is a time where it's especially important. Trying to think ahead before you talk to maybe some of your loved ones. What is your comfort level and what is your expectation for Christmas? I'm telling my patients right now, think of your comfort level first. Think of what you are wanting to do first, because once you get into that conversation, you can really be swayed. Try not to get pressured into anything. It is okay to say no. And believe it or not, some people don't realize that. It's okay to not agree and have a different opinion. If other people have their opinions, that's theirs, but you can agree to disagree. And you also are allowed to change your mind. So let's say you say yes to something and then you go away and think about it and you don't really feel comfortable. You can change your plans, and that's okay too. So like I said earlier, I actually get my patients to write down a coping plan. And this would be an example of what might be included. So the first step is to anticipate those obstacles. We have some examples on the left here of some distressing situations that could happen. Maybe being tempted to overindulge with food or drinking, feeling lonely or sad because Christmas is kind of weird this year, and feeling pressured by relatives to come, maybe being guilt tripped. That tends to happen a lot. So some examples might be setting a limit ahead of time, sticking to it, and then trying something else to soothe. So replacing the drinking or the eating with something that maybe comes with less consequences. That could be helpful. I think one of the bonuses this year, and I'm actually hearing a lot of patients say this too, is that they get to avoid all the really stressful parts of Christmas. Usually the number one of complaints are family drama and crowds. Those aren't happening this year. And so you get to avoid that without having to come up with an excuse. It's kind of a break from normal Christmas time, and that might be kind of nice and peaceful. In terms of the guilt trip, the pressure, this is where the assertiveness comes in. So I think letting people know in advance so that they have time to get used to the idea, and then reminding yourself you're not doing anything wrong. People have different reactions to stress, and people have different reactions to these restrictions, and they might be kind of lashing out and acting this way because they're also struggling. And I think having some really good coping self-talk, I'm going to talk about that in a minute, can be really helpful too. So reminding yourself that you can do this because you've gone through hard things before. This is that resilience piece. The second part of a coping plan would be to come up with some strategies for self-soothing and thinking of those ahead of time too, because when you're kind of in the moment faced with it, feeling distressed, you might not know what to do. So there are examples here on the screen, but basically what self-soothing is things you can do to calm yourself and things that bring you back to the present moment, things that kind of feed you emotionally. And then, like I said earlier, an emergency plan is really important. So if you know that you're kind of susceptible to feeling at risk for hurting yourself or even just having thoughts, it would be helpful to plan ahead for that. So some self-soothing strategies might be a good first step. Talking to a loved one or a therapist if they're available. There's also single session therapy at Eastside Community Mental Health Services. This used to be called Eastside Family Center. And since the pandemic, they've been doing phone appointments. So you can actually book a single session if you just need to talk to somebody on their website. You can book in advance or you can even book the day of. Now, I know they're not open stat holidays, so that wouldn't work on Christmas Day. But even the days leading up to that, the number I've listed here is actually the phone number to book an appointment as well. The distress center is always available, and that's a really good one for even on Christmas. And then, of course, if you're feeling very unsafe, the most important step would be to take yourself to hospital or call an ambulance or get someone to take you. I think it's important to remember that it's okay to feel things. It's okay to feel feelings right now. And actually, it's normal, and it would be kind of weird if you weren't feeling things. It'd be kind of weird if you weren't struggling, because this is a weird time. This is a difficult time. So it's okay to feel sad. It's okay to feel angry. I think most of us are feeling helpless and overwhelmed. But it's also okay to feel relieved. If you're feeling like, this is great, I don't have to do Christmas like I used to have to do it, it's not going to be as bad, that's okay too. You don't have to feel guilty about that. And if you're having trouble getting into the Christmas spirit, like I think a lot of people are, that's okay too. So I think the key is balance. I think it's important to give yourself permission to feel the feelings, but also try to use some skills to manage the feelings. And it's always a balance between those two things. So I'm going to talk a little bit about what you could do to manage some of those feelings. Back in the spring, with some of my colleagues at the Northeast Mental Health Clinic, we put together a toolkit. And it actually still applies for today. And I included the direct link for that toolkit so you can access it. But what I'll do today is I'll just highlight some of the skills that we cover in the toolkit. So the first set of skills is relaxation skills. When you're feeling anxious, stressed, angry, overwhelmed, it's going to come out in your body. Our minds and our bodies are very closely connected. And if you can calm your body down, you can also help with your emotions. So the very first, most basic, most important strategy to use is breathing. And it has a physiological response in the body. It's really, really important. And when you're breathing, you need to be breathing with your belly, which is often a really confusing thing for people because they've never breathed this way before. And actually, when you're breathing in, your belly should pop out like a balloon, inflating. And when you breathe out, the balloon should deflate. Often I see patients are actually doing the opposite. So they're sucking their tummies in when they breathe in. You actually need to be pushing your belly out because that's using your diaphragm, and that creates more space for your lungs. And when you pace out your breathing, slow down your breathing, it can be really helpful. So square breathing is where you breathe in to the count of 4. You hold your breath for the count of 4 to slow down your breathing. You breathe out to the count of 4 and you hold again. Some people call it box breathing. And even just the act of focusing on your breath helps you to get out of your head, helps you to stop with the worrying and the ruminating. Very, very helpful. The second skill is called grounding. There's lots of ways to ground, but I have a few of them listed here. Grounding is about helping you reconnect with the present moment, because when you're lost in your thoughts, you're either lost in the future or the past. And when we're anxious, we're usually in the future. When we're feeling down and depressed, we're usually kind of stuck in the past. So grounding can be really helpful to reconnect you to the present moment. You can list as many things around the room that you can see. And you can even do this out loud, right? You can list as many colors in the room as you can see. And then there's a strategy called 5, 4, 3, 2, 1. So listing 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste in the room. There's also some really great apps that are free or low cost. So I've listed them here, and they will actually take you through a relaxation script or strategy. That's the beauty of technology these days, right? Is that these things are really accessible now. And a related set of skills is called mindfulness. So mindfulness is about being in the present moment with acceptance and without judgment. I think this can be really important right now because accepting where we're at is exactly what we need to do. It's about becoming an observer of yourself and responding with compassion and kindness while letting thoughts and feelings come and go, just allowing them to be there. Again, lots of good websites, lots of good apps that you could access to practice some mindfulness. I think coping self-talk is really important right now. And coping self-talk is about reminding yourself of your strengths and your resilience. Literally saying these things to yourself, either outside in your head or outside your head. And you could even write some of these down or come up with your own, put them on your fridge, somewhere really visible. Stick them on a sheet of paper in your pocket or take a picture with your phone so you always have it with you. And so reminding yourself of things like it will be okay. Take things one step at a time, focus on what you can control. And this is just one Christmas. You can get through this. It's just one Christmas. You've coped with tough things before and you can do it again. I think it's important to kind of zoom in right now. That's something else we talk about in the toolkit, is you need to focus on today, tomorrow, and this week, and try not to focus too far ahead of that. That's what we need to do when things are getting stressful. Now, I know this sounds really cliche. I know that you hear just be positive, and that's really annoying. But it is a time to reflect on some positivity. There are some silver linings to this Christmas. I think it's helpful to think about your personal strengths, maybe your strengths as a family that will help you get through. And the silver lining is it is an opportunity to slow down, rest, and be present. You get to avoid that family drama and the crowds and the pressure with an excuse. You don't even have to make one up. And it's a chance to try new things, new traditions and activities, a chance to be creative and think outside the box, and maybe do something you've always wanted to do that you never got to do. I think another piece that can help is to focus on giving back to others. I think there's a lot of people in need right now. So volunteering in the way that you can, maybe helping a neighbor or a senior shovel their walk, maybe supporting local businesses. They're hurting right now. So, I think that's one way that we can give back and really get outside ourselves. And the last thing I wanted to talk about is gratitude. I think gratitude is so, so important generally, and it can be so helpful right now. These are my personal gratitude jars. So I started this activity a few years ago with my husband. I saw it on Facebook as an idea of something to do instead of setting New Year's resolutions, which we all know are usually over by January. So what this involves is like, I just have sheets of paper in my kitchen, and I try to do at least one a day. And I try to think of something that I'm grateful for. And you can always find something, you really can. And what's really nice is that the following New Year's, you get to open the jar and you get to open the pieces of paper and see all the wonderful things that happened that year and all the things that you are grateful for. And you also don't have to leave it till New Year's to open. It can be a really great self-soothing strategy too. If you're having a bad day, you can open up the jar and pull out a piece of paper. And it's really nice to remember a positive thing that happened. So I hope you all have a safe and peaceful holiday. I hope you all find something to be grateful for. And thank you so much. I'll turn it back to Rick. Perhaps we have time for questions. I'm not sure.
Thanks so much, Vanessa. And I was, this is the second time that I've heard this talk, and you know, sounds cheesy, but you know, you're in my gratitude jar, girl. It's just really great for you to join us, and all the super resources that you've left us with. And we will make those resources available on the archived presentation that's on our website, and we'll also make it available through an email blast to those who have registered. So Vanessa, thanks very much again. Have a happy Christmas.
Great. Thank you, Rick.
Okay, before we bring our infectious disease Mike Parkins in, I have to talk a bit about fake news. And tonight was supposed to be about no fake news, only the real truth. And I started it off by saying, go to that little chat box on the right-hand side and ask your questions and we'll answer them. Man plans, God laughs, and he's giggling about this one. We were unable to overcome the technological barrier, so that chat line does not exist. But we really do want to try and be responsive to your questions. So here's an email that we will be able to respond to those questions. And I apologize. We think that will be the only piece of fake news you'll hear tonight, me pumping the chat line. Michael, welcome and thanks very much for joining us tonight. I've introduced you earlier as being an infectious disease expert, being one of the stars of our primary care family physician webinars, giving us the up-to-date information. The audience is different. We've got about 1,500 plus of our patients at Crowfoot tonight. They've sent a whole bunch of questions in, and guess what the number one question was? It was about vaccines. So again, picking up on Cynthia and Norma, who want to know a little bit about what's the latest on the vaccines, and what advice do you have to give to us about those?
Yeah, so there is a lot of information that's coming, obviously. There are at least 202 vaccine candidates that are in clinical trials, let alone the 3 that we've heard lots of in the news of late. The first from Pfizer, then Moderna, and followed a few days later by AstraZeneca. The early clinical data on those papers that has had the potential for peer review were based on phase 1 and phase 2 studies, so dose-finding studies where we looked at the immune response. The phase 3 studies, which shows the efficacy of the agents, has been reported by the company on their financial announcements, as well as been submitted to the FDA, Health Canada, and the EMA, which is being used to evaluate the efficacy of these therapies, but has not been sent out for peer review yet. So a lot of the information that we're relying upon as clinicians is directly from the company. However, we're all very excited about the early results from these studies from very reputable companies showing efficacy rates much higher than we'd even hoped for. So we've seen reports of 90 and 95%, or a composite of 62 and 95% for the AstraZeneca. The two mRNA vaccines from Pfizer and Moderna are first-in-class vaccines. We've had clinical trials for mRNA-based vaccines before, but none that's actually used in the human population. Although that really doesn't change a lot. We've had a lot of DNA-based vaccines we've used for quite some time. mRNA-based vaccines merely is a step closer to the protein being produced in each individual host. The safety profile from these medications from clinical studies certainly was very strong. And once a drug is introduced, it will still undergo rigorous monitoring in the early stages when it's taken up. So we have phase 4 monitoring as well as continued assessment. And that's one thing that the drug companies have been very upfront about, is the importance of monitoring for adverse events once a drug is being mass administered. And already there's reports in the news of some allergic reactions associated in the UK with the Pfizer-based vaccine. But that's certainly to be expected with the amount of vaccine that's being administered. Again, you can be very confident with the rigorousness with which our health protection agencies review drugs and vaccines, that when something has been approved, it has gone under great in-depth review. And while there have been examples in the past where mistakes were made, we've learned from those mistakes every step of the way. And with vaccines in particular, because we're administering them to a healthy patient population, we have very low level or low threshold with which we will allow for adverse events. So again, when Health Canada tells us these vaccines are safe and effective, we can certainly believe that. In terms of the distribution of vaccines, when we do have access, that's going to be a little bit more complicated. You would have heard that the Pfizer vaccine requires extreme cold storage, and that's something that can easily be accommodated at large centers. And getting the Pfizer vaccine out to very small communities that are quite far away from larger centers will prove challenging, but something that certainly we can do. The Moderna vaccine doesn't have the same severity of cold chain requirements, but still requires cold storage at -20. Whereas the AstraZeneca vaccine, which is a much more common platform associated with an adenovirus, really can be shipped on refrigerated temperatures, and we don't have particular concerns there. So again, the vaccines, the 3 that we've seen reports on in terms of phase 3 findings, all look fantastic, way better than we'd even hoped. The fact that there's multiple candidates vaccines means that we will have a robust pipeline, and we will have different vaccines rolling out at different times. But again, when we hear from the various agencies that they're safe, I have every reason to believe that they are, based on the data that they've received from working with very reliable drug partners.
Thanks, Michael, and that answers a whole ton of questions that came in. You mentioned that this is a messenger RNA based vaccine, and for those of you who want to dive deeper into what that is, Dr. Casey Miller found a really cool YouTube explanation of what that is. We would have put it on the chat, but you know that the chat's not working, so we will get that to you. Another question about the vaccine. So this is not a live vaccine, and so what are the implications of this vaccine going to special populations, immunosuppressed, for example?
Yeah, so very important question, Rick. Thank you for that. An mRNA-based vaccine, which includes instructions on how to make the spike protein of the virus, and that's the most external part of the virus. And what the immune system is going to recognize first is not the whole virus in and of itself. It's just the ability to create a protein. So there is no risk to the immune compromised population associated with this vaccine.
Another virus question, and it came in from Bob T, as well as one of my patients today, who said, look, I'm planning on getting the Shingrix and the pneumococcal vaccine. I'm worried about the COVID vaccine and being exposed to yet another vaccine. Is that something that we should be worried about?
Certainly not. I mean, we know from our immunization schedule in infants that we can administer a number of vaccines at the same time. Really, what we want to do is prioritize things and make sure to deliver the vaccines that have the most potential benefit. And certainly right now, with everything that's going on in the world, a COVID-19 based vaccine is the biggest priority for all populations, regardless of risk.
And Michael, it may be too early to ask this question or answer this question, but is there any sense of how long the duration of protection there'll be from the vaccines?
No. So what we know about vaccines is that antibody titers do decline over time. We would normally follow these in observational phase 4 studies. And that's something we're going to have to do on the fly with COVID-19. But just because immunity declines over time doesn't mean the vaccine's any less effective, not knowing that it does decline. Simply what we do at that point is look at giving boosters. And again, it's not like they're going to drop off a cliff and you'll be protected one day and the next day you're not. This is something that we have at least years of protection.
And again, a question that may not be answerable now, but you know, with the flu shot, there's a different variety of influenza that goes through the community every year, and we have to modify the flu shot and give it every year. Is there a chance that that kind of situation will happen with COVID?
Unlikely. So we have seen mutations in the SARS-CoV-2 virus. That's the virus that causes COVID-19. We have seen mutations in impacting the spike protein as well, but none that seem to have reduced the potency of the elicited immune response that we are using. Again, while we may see mutations, it's exceedingly unlikely that we'll see resistance to the vaccine emerge. While a possibility, it's very unlikely. The influenza virus is a wonderfully complex beast that involves a segmented genome. And because there's so many influenza viruses that affect other species, the potential for mutation and change is just monstrous relative to SARS-CoV-2, which really affects humans and the animals we live with, can affect cats. Of course, we hear about mink farms as potential issues where mutations can occur. But again, I think that's exceedingly unlikely.
I want to just pivot a little bit to some of the other topics that have come up. One of them was around how come we're not seeing any influenza? There was the question of, well, could influenza be sort of pushed out by COVID? What's happening in that space?
Yeah, we expected this. So the Southern Hemisphere during the tail end of our winter, which would normally be their spring period, we're already experiencing lower rates of influenza, and we expected the same to occur here. And in Alberta, I believe last I looked, we'd only had 2 cases of influenza so far, which is pretty phenomenal. And it just shows us that when people take proper precautions and socially and physically distance from one another and are aggressive with hand hygiene practices and avoiding interacting with others when unwell and even wearing masks, these common infections can very much be reduced. That being said, we still see some other respiratory viruses, and in particular enteroviruses. And for those of you who have children, you'll see that occasionally colds still come through, but to a much lesser degree than we've seen in years past.
My buddy Nurse Nell asked a question just late today. Please comment that there's a lot of chatter that school children are the most significant virus carriers while remaining asymptomatic. True or false?
So children are less likely to experience symptoms with SARS-CoV-2 than adults. But we also know that when people, when we do aggressive contact tracing associated with COVID-19, we find that children are much more likely to infect other children than they are older age ranges. And that's just a relation of their social circle. So children are less likely to experience significant disease burden, but that doesn't mean it can't happen. And it does happen. And you certainly hear of case reports on the news of children experiencing severe events from COVID-19, although to a much, much lesser degree than their grandparents.
Michael, there's a number of questions. Diane raised one of the first about masks, and there seems to be this difference of opinion. Some people say, yes, these masks are great, and if we all wore masks, COVID would be stopped in its tracks. Others are saying the masks do nothing. It's a waste of time. Everybody's wearing masks, and yet COVID is spreading. Help give us the truth between those two extremes.
Masks are one tool and a very important tool in our toolbox. They are certainly effective at reducing risk of transmission and risk of acquisition. In terms of, do you have to only wear a mask and you're protected? The answer is no. The single most important thing we can do is act socially responsible, and that means not putting ourselves in a position in which we are at risk of acquiring COVID-19. So that means separating in space and time from other individuals. When we can't separate in space and time, and we can't always, we will have to restock and hit the grocery store every once in a while. Masks are a tool that we can use to reduce our risk. Masks are a tool that have to be used correctly, however. Masks do concentrate respiratory secretions, and if someone is adjusting their mask all the time, they're going to be contaminating the environment. So it's really important that we emphasize to our community members, you put your mask on and you leave it on. And if you have to readjust it, you wash your hands first, you readjust your mask, and you wash your hands again. But there is no doubt that masks are effective at reducing transmission and acquisition risk. And they are safe. There is no risk of mask-associated harm.
Great. A lot of questions, and there are two themes before we let you go, Michael. The first theme is around spread in inanimate objects, and the last theme is about people who've had COVID and what the long-term implications are. So lots of questions about, do I need to put my fruit in the microwave when I take it home from Safeway? How long should I wait before wiping food off before using it? What's the transmission risk from inanimate objects, and what are your recommendations?
Yeah, there's certainly risk of transmission from inanimate objects. However, how commonly are these objects in the grocery store handled by others? It's, I think, a pretty rare event. I think wiping things down is probably not a good use of time. It's being very careful with what you touch. So touching objects that other people are touching, door handles, pens, things like that are really, really critical. Wiping those common touch surfaces on counters down, really, really important. Wiping down every apple you get when you get home, the answer is you just rinse your apples off. What we do know about the virus is it isn't particularly stable in the environment, and we will see that it is most protected at refrigeration temperatures in the absence of light. If we do have objects out in a warm environment, the virus will decrease rapidly over a matter of days in terms of the amount that it's present. But again, it's really, really, really important that on high touch surfaces where seating is possible, that we wash our hands very frequently. And the surfaces that are most at risk are metal and plastic based, because that's where the virus particularly lasts a long time.
Great, great information. So I think that in the shopping, be vigilant. Don't be touching lots of stuff to protect the next person, but we don't need to be too obsessive about cleaning everything off. A simple wipe will do.
That's it.
So a bunch of sort of rapid fire questions. For people who have had COVID, do we know if they remain immune? And if so, how long that immunity will last?
Yeah. So there have certainly been several well-established cases of repeated infections that can occur. Make no mistake, these are rare, and every ambitious scientist is looking. So again, it's not like we're not looking. When we find concerns for patients being reinfected, we're looking to try and establish that, because people want to try and get that information out. So there's a handful of cases where it has happened. It's probable that those cases don't associate with as severe disease, but that's clearly not established yet. More time is required. Again, we've only been dealing with this infection for a year now, and how this plays out over the next years, 2, 3, or 4, we don't know. But certainly short-term immunity is expected. What we know from other coronaviruses is that reinfections can occur and that immunity does wane. And those are the common colds that we get. But they don't knock us out once we've had them. And that's certainly what we would expect and certainly hope with SARS-CoV-2. But again, only time will tell.
Thanks, Michael. Jia Hu has joined us on the line. So 2 really quick questions, and then we'll put him on the deck. Should people who've had COVID, should they be immunized?
Yes. Yeah. Again, we've got no information to say that they will not benefit from that vaccine.
Great. And again, there's a question about super spreaders, and could patients who have recovered from COVID become super spreaders?
I'm afraid that there's not data to say whether that's possible or not. What we know is that the majority of patients who've had COVID-19 don't spread to other individuals. It's a minority of people that are responsible for the vast majority of disease propagation. And a lot of that's related to how people behave and the choices that they make. And we all want to be as responsible as possible to protect ourselves as well as to protect everyone around us and in our community.
Great words to end on, Michael. And it's really great that you've had on your screen at the back pictures of the 2 new family physicians that we've recruited for Crowfoot. Good day, eh?
Thanks, Rick. Take care.
Cheers. Jia Hu, welcome. And Jia is, I would say, the busiest man in Calgary. He's medical officer of health and has boundless energy, huge wisdom, and a great sense of humor. Jia, thanks for joining us tonight. We've had only a couple of questions about the new regulations that were released last night. Can you walk us through the high level of what the new recommendations are as we go into this Christmas season? And I feel like I should be making a Grinch comment here, but we know it's for the public good.
No, happy to, and thanks for the people who are attending for attending. I think you're all patients of one of the best places you could be a patient of. So good on you. So yeah, anyways, so as Rick mentioned, I am one of the MOHs in Calgary, amongst a few other things that I'll talk about when I talk about the vaccine and people have questions about that. But as you know, there were some new sort of restrictions that came in yesterday. Alberta has a lot of cases, right? We're running at, close, well, like near that 2,000 case a day mark. And so what's happened is that, like other places like Ontario, where I do a lot of work as well, they're also at around that case count, but they have, 3.5 times fewer people. And so I think that what happened yesterday really is quite important to ensure that, frankly, our hospitals and ICUs are not overburdened, and that the harms of COVID not too, can be managed. And so, with that, I think the rules are not super complicated. There's basically no indoor gatherings allowed, no outdoor gatherings allowed. Many things have been closed. The things that remain open are allowed to sort of operate like malls at around 15% capacity. And so I think that this will bend the curve, so to speak, because now we've entered I don't really like to use the word lockdown because it doesn't necessarily mean anything, because like, what is a lockdown but a series of events, a series of things that people are asked to do. Yeah, we're in a sort of a bit of a lockdown now, right? I think that, the next, 8 to 12 weeks maybe will be the darkest weeks of the pandemic for this province, right? We're at sort of like the highest case counts that we've, had. We certainly in Edmonton, we have begun to see, the health system begin to strain a little bit, particularly when it comes to ICU capacity. Calgary is probably, 10, 14 days behind Edmonton in terms of what's happening. But I'm also very confident actually that we'll make it through, right? And so, right now, the thing that I worry most about is ICU capacity. And the thing that affects the rate limiting step there is actually staff. And, I think the government has planned for, 400 ICU beds for COVID, which is far more than we should need actually, even the rate we're going. Which is actually why I feel reasonably okay. But, again, the next 8 to 12 weeks will not be easy, right? This is a Christmas where you're not really supposed to see people except through Zoom. And I think that'll be very difficult. So, try to stay in touch with one another, try to do some outdoor exercise by going for walks. And 8, 12 weeks from here, we'll emerge from this, right? Every place has, at which point we'll be entering what I call, sooner than 8 weeks, vaccine territory. And that's really the good news, right? I think there's been a lot of uncertainty around when vaccine is coming. This is stuff that changes sort of day by day, but it's coming pretty soon, not a whole lot initially, but more and more of it will come. And I think it's just really important that as you think about that, and that people, the first people in line will be, healthcare workers, sort of makes sense. And so the general population won't be able to get it till probably late Q2, somewhere in Q2, I'd imagine. But if we get through these 8 to 12 weeks, we'll be entering this territory where the cases will be lower, spring will come, and things will just get better and better. So yes, be kind to yourselves, be kind to others, go on Zoom, drink some wine, don't drink too much, but drink some wine or whatever it is that you drink. And should I keep talking about stuff?
No, Jia, let me follow up because, we got many of these questions before Dina Hinshaw made her announcement yesterday, and a lot of it was around, look, my son's been working as a paramedic in the far north. We've been away from them for 6 weeks. They're coming down with our grandchild. Is it safe that they come because they need the rest? I've got other people have relatives who are coming in, flying in, tickets bought, expecting that they would have a Christmas together. I know it's a hard question and I'm sure a hard answer, but what's the advice from public health around those kinds of scenarios?
Yeah, I mean, I think unfortunately, if you have family flying in from elsewhere, like they, unless they can come and stay in a hotel, but they shouldn't stay with you, right? This is it. Like nothing, no indoor social gatherings. I think that often people think the greatest amount of transmission happens at bars or spin studios and that sort of thing, and that may have been the case very, very, very early on. But now the vast majority of transmission, while it's read as unknown, unknown just means we haven't identified a place where it came from, where it's usually like when it does come from when it's associated with a particular location, we do find out. So what I'm saying is that most transmission occurs at what I call private social gatherings, or when people go to people's houses and hang out with one another. And when Edmonton hit 1,000 new cases a day, like last week, those numbers, if I extrapolated to the US population, be 300,000, 340,000 new cases a day, which is more than the US has. And, it's, I like probably hanging out and socializing more than anyone. I'm quite an extroverted guy with lots of emotional needs, but now is not the time, right? Alberta is not in a good place. Alberta is by far the worst off, maybe Manitoba, but for a province with a lot of cases, I love Manitoba. They had a lot of cases at one point. But I think that, it's to keep yourself safe. It's to keep the people around you and the ones that love you safe. It's to keep the healthcare system sort of, up and running. We always talk about ICU capacity, why? In the earlier days, in Italy, for example, in New York, what happened is that there was a mortality rate to COVID, right? People will die from it. If you're younger, less likely. If you're older, more likely. But if you don't have ICU capacity, that mortality rate skyrockets, right? Because you can't be treated, right? And if you don't have a ventilator, when you need a ventilator, you're in trouble. And this doesn't just apply to COVID. We want to make sure that people, other people who need ICU, people with heart attacks, people in car accidents, and that'll happen still in the same way it happens all the time, also have access to those ventilators, because an overwhelming the health system leads to an increased mortality across the board. And, I think that it's really difficult. This will be difficult. There's no denying this will be difficult, but this will be, I want to see my parents in Edmonton. They live by themselves. They're pretty good at isolating though. They're sort of anyways, but they want to see me and they're like, Joe, are you coming? Are you coming? Are you coming? And even more recently, a few days ago, they're like, yeah, maybe not. Don't come. And so I think this is something that we have to do we all have to do it, right? This is what, COVID is an interesting thing because it, controlling it, people like me in public health and people who work in the hospitals, they react to sort of the consequences of the number of cases that we have, but all they can do is react to what's already happened. To stop COVID fundamentally requires individual people, every single person, to take the action to prevent COVID from happening in the first place. And we need that more than ever now. It's a bit crappy that it's over the Christmas season, but yes, none of that. I'm sorry. Try to get a refund from Air Canada, though they're not being too hot on that these days.
No, Joe, I think you're speaking obviously a very hard truth, but one that's really important for us to hear. And because we've sort of killed the Christmas spirit off with this discussion, I've got a really good question that came in from Fuzzy Kitty. So Fuzzy Kitty asks, I have a crazy relative that says this vaccine has the potential to sterilize women due to something about the protein being similar to the one in the placenta, and it may trigger an immune response in pregnant women. This is just crazy talk, correct?
Yes, I would say so, 100%. It's interesting, actually. There's a large COVID physician Facebook group with 25,000 members. And that very comment was actually asked even on that group. It was shot down quite quickly, I think, which is a good thing. But I'm saying this because, the concerns that you have, like many people, maybe not that particular concern, but many people also share. The vaccine, I'll tell you a bit about the vaccine, right? So the first thing I'll say is that a vaccine is only useful if people take it. right? The same with, the medications like that Rick or Ian prescribes you perhaps, right? And right now in like across the country of Canada, I mean, depending on how you ask the question, about 40% of Canadians would take the vaccine as soon as it was available for them. And in Alberta, it's about 10% less. So we are very lucky that a vaccine, well, I remember that when the Pfizer press release came out in the New York Times, I was like, oh my Lord, 95%. Like it was like more effective actually than our wildest dreams. Than my wildest dreams. We knew that it would be approved with a 50% efficacy. Efficacy defined as, if you take the vaccine, you have a 50% lower chance of getting it, or in the case of the Pfizer or Moderna vaccines, you have a 95% chance less of getting the actual, symptomatic infection. So these vaccines are, from an effectiveness perspective, are like COVID eradicating like effectivenesses, right? Like the best vaccine we have probably right now is the measles vaccine, which is about a 95% effectiveness. And this is in that territory. Now, I think that, what we actually know about vaccines and why people take this one, why people take them, why people don't, the two biggest reasons why people don't want the vaccine would be concerns around safety, which I'll talk about actually. And the second one is actually mistrust in government, institutions, pharma companies, or the establishment, so to speak, right? So on the safety piece, right, to be transparent, we do not know, there are things we don't know about the vaccine, right? It is absolutely true that these vaccines are being approved based on, we'll say like interim data, 3 months of data. But on the other hand, what makes these things, what would I say? Like what the way you look at safety is this, right? You to decide whether something is safe in my mind is, partly you want to see, how long it's been out for, but you also want to see how many people have gotten it, right? So, if 1 million people drink something and none of them turn into, aliens, it probably won't turn somebody into an alien. And these vaccines have, have been tested on more people than any other drug product vaccine ever before. And the other thing I'll say is that, yes, we have questions about, the safety. I mean, these would not get approved if there were like significant concerns about the safety of the vaccine. To date, there's been nothing to suggest that these vaccines like cause any significant adverse events. And, that could change, but that's what we know for now. And the regulators that approve these vaccines, and this is me trying to shore up trust in government, especially Health Canada, they are very, very rigorous, actually traditionally known to be very slow compared to other regulators. In the US, I think, the FDA, well, under Trump, there were some concerns about the independence of the FDA, but now it's sort of regained its independence a little bit. And in Europe, again, where the regulators have a lot of experience, you see the UK approved the vaccine, and now like already people are getting the Pfizer vaccine. So I think on the balance of things, like anybody like for who the vaccine is recommended, which is like most people should get it. You have to wait a few months depending who you are. But I think that I'm happy to like actually answer specific questions around safety, but no, like again, it's not.
No, thanks, John. I know that we've only got you for another few minutes. Just for the audience, we're going to let Jia go in about 7 minutes, and then we've got some more questions that our CVFP team will address. Really good question from my patient, Cheryl. Unclear in listening last evening to Dina Hinshaw as to whether we can walk with people who are not in our household, provided we wear a mask and social distance.
That is a very good question. I'm trying to look something up around that.
I know Cheryl, and she's a good one for questions.
Yeah, I know. Outdoor group physical activity must be limited to 10 people or fewer. Members of different households must maintain 2 meter distancing at all times. So I think you can go for a walk, but just stay away from one another. The one good thing we know about COVID is that outdoor transmission is much more difficult than indoor transmission, but like 20 times more difficult. Yeah, you can go for a walk, but stay 2 meters away and keep it under 10.
going to go back to a pregnancy-related question. You said there's very few people who will not be, who should not get the vaccine when it comes out. And Mike reassured us that the safety of the mRNA vaccine as we know it. A bunch of other questions about if we are trying to conceive, if we're in that space of either early pregnancy or trying to get pregnant, would that be a contraindication to getting the COVID vaccine, at least as we know now?
Yeah, I actually have a little nasty statement on that may still be embargoed, but let me pull it up. I mean, like I'll pull it up, but basically the message is this, right? For better or for worse, most vaccines and most drugs are not tested in pregnant women, right? That's a bit of a gap, and it's hard to recruit people into those trials. And certainly, I think that makes sense for this new vaccine. I would say that it is advised not to get the vaccine if you are pregnant or breastfeeding, unless there's an extremely compelling reason to do so. And it'd be hard pressed to come across one, right? So we're going to give this vaccine primarily initially to high-risk people, whether by sort of like where they work, healthcare workers, meat plants, where they are, some of the indigenous populations, and sort of the healthy general public. And women are generally relatively healthy given like their age, are not going to be in line sort of for the vaccine anytime soon. And even the topic of immunosuppression, right? Because the only situation which I think like you might think I should get it, pregnant, some sort of immunosuppressing condition, even that right now, there's not enough evidence around the Pfizer vaccine around if it helps in that situation, probably will, but you should get it. So to keep it simple for now, no, we'll just leave it that way. No.
And Rick asks, how long do you think it will take for us to achieve herd immunity in our population?
Well, that depends how many you get immunized when the vaccine. It really does, right? Trudeau said that, and I like this one. Canada's literally bought more vaccine per person than any other OECD country, and that's good. And don't worry, any vaccines we don't get will go to this pot that goes to other countries. But 40% of Canadians will get a vaccine as soon as available. If we ask you differently, about 60% of people will get vaccinated, Alberta lower. And so, we will have, I would say that if we're really good at uptake, we can, achieve quote unquote herd immunity or enough coverage to suppress the disease 3 months earlier, if not longer, than if we don't have that. And so that depends on all of you, actually. When the time comes, please get the vaccine. It'll be good for you. We can go to parties, and the next Christmas will not be like this Christmas.
Thanks, and a shout out to my resident, Dr. Ronke, who's on board, who's been pushing those immunizations already to patients. So yeah, go Ronke. Listen, interesting question from Nancy. Is it possible to have COVID and not know it? And if that happened and you got the vaccine, would that be a bad thing?
It is definitely possible to have COVID and not know it. So yeah, we know you can have asymptomatic infection. As Mike was saying, the answer, even if you had COVID and you knew it, would you get the vaccine if you're supposed to? And the answer is yes. So, I mean, I think that I don't have much time, so it's fine. So yes, just get the vaccine if you're in the population that's supposed to get the vaccine. Normally with these infections, if I have, what's a good example, measles, and I get a measles vaccine, even though it won't do anything because I'm already immune, it's also not going to do anything bad.
Oh, Jia, actually a great question here that I was going to ask Mike, but I know you can pick up on this. Questions about, and it comes from Heather and Larry and others, questions about rapid private COVID testing. Is it accurate? Is there any time when you'd recommend it?
Yeah, so really good question. So when it comes to rapid, I'll say private testing. So there's so many different testing platforms out there, right? A good example of this is the United States approved 10 serology tests before Canada approved one. Now, The issue with doing that is that Health Canada actually is a bit slow, but on the other hand, like what we do in Alberta, which I think is a great thing, is just because a company says the test is like 95% accurate doesn't mean it actually is. And so our friends at the lab have been validating all the tests that we want to use. So I think that, you know, I can't make a blanket recommendation on whether or not private testing is accurate. Like a lot of it is, some of it might not be. It depends on the test itself. And you should ask your family doctor that. And if they don't know, they'll probably ask me, but it'll depend on the test, and that's totally fine. You know, rapid testing versus like not rapid testing. Again, it just depends on the test. And the question is like, when would you use it? So if you identified, one example might be this. If you needed to travel, and some countries require a test before traveling, like a proof negative test, and right now we don't really do asymptomatic testing anymore, that would be like a time to get, you know, private testing, for example. And, you know, there are a few places, and this market is exploding. There are a few places that I think are pretty legit, and ask your family doctor, and your family doctor will ask me, and we can talk. So. Yeah.
And Jia, that's great. And what you can do, I know that you're not into giving commercials for people, but maybe we'll connect offline and we'll be able to make that resource available to people who are on online. So that'll give us a good degree of separation. Hey, my buddy Janet W says, will we need to wear masks once we are vaccinated?
Yeah, so that's a really good question. And I mean, the answer is this, right? Like, there will be a point, let's say, when we have herd immunity, when the public health recommendations are lifted and you won't have to wear masks. But that's, you know, that's at least, you know, like many, many months away. So in the meanwhile, please continue to follow the public health recommendations, including wearing masks and social distancing. There's a few things we don't know about the vaccine. I mean, for example, the Pfizer vaccine, it really tested symptomatic infection as opposed to asymptomatic infection. And so you might still be able to spread a bit of COVID even if you get vaccinated. So just always follow what Dina tells you to do. Just listen to Dina. She's very lovely and trustable. Just listen to Dina. She's much better than I am.
That's a really good mantra. And Jean, many tables that you and I have shared, you've really passed along your personal confidence in the job that she's doing, and how her voice has just been so strong and so sensible and so balanced. So it's always been nice to hear that. So I'm going to give you the final question, which is just if you can go over the isolation rules. So I've been in contact with somebody who tested COVID positive. What do I do?
If you were in contact with somebody who tested COVID positive while they were infectious, you must isolate for 14 days from when you last interacted with that person. So if me and Rick had dinner today, and that would be a bad thing to do, that like we're not allowed to do that, and he was COVID positive, and you know, I found out tomorrow that he was COVID positive, then I would have to isolate for 14 days from when I last saw Rick. And that 14 days is 14 days because of the incubation period of COVID, the incubation period being the time from when I see the COVID positive person to when I develop symptoms. And it can be anywhere from 1 day to 14 days long. And so that's where the 14-day rule comes from.
Great. And of course, the irony is that if you've got COVID, then your isolation period is shorter, right? You just have to self-isolate for 10 days or until those respiratory symptoms remit, whichever comes last.
Yes, exactly. And that's because 10 days, because, you know, we generally, you're no longer infectious, you know, like after 8 days normally. That's like, you know, you can have dead virus, doesn't matter, but live virus stops existing after 8 days. And then we give it a 2-day buffer, which I think is pretty reasonable. And so, yeah, that's what happens. But don't go around trying to get COVID to get the 10-day isolation lower than 14 days. Because, and I will say this, right? I think that, you know, too often, especially if you're sort of like young and healthy, you think that it's fine, right? There's been plenty of, you know, healthy adults like now in our ICUs actually, but more than that, you know, we are beginning to see, like, and we still don't know this, the long-term effects of COVID, right? Up to half of patients still have symptoms months after their COVID ends. And so when I work with some of the elite athletes where like, like it really matters, it's really bad, right? Like if you even have like a 10% decrease in lung performance or something like that, that stays with you forever and not worth it. And that's also part of the reason why you shouldn't see your family right now, which is sad. If your family is not in your house, but it's not a nice disease.
Yeah. Jia Hu, thank you very much for sharing your wisdom with us, your honesty around this. And again, I know that your words about that you're a social guy and it hurts you to the core to say, don't hang around with your peeps, but that's the soup of the day for this Christmas. Thanks so much again. We'll let you go back. You must have at least 2 or 3 meetings left tonight, so we'll turn you loose on those. And I'm going to put my Crowfoot colleagues on the spot now with some of the questions that came in. And you'll always start with the most difficult questions, and the most difficult questions always go to the pharmacists. So I'm going to call on Jen Lamb to take this one. Jennifer, there's lots of comments and questions that we got about, do taking anti-inflammatory medications or ACE inhibitors, blood pressure medications, Advil, ibuprofen, do those put you at risk for catching COVID? And Jen, we'll just take you off mute.
There you go. I believe this question refers probably to the early pandemic speculation that NSAIDs were thought to increase the point of entry for the COVID virus. And then in doing so, you increase your risk to contract the disease or to suffer worse consequences from it. But so currently the FDA, the WHO, and the European Medical Agency do not recommend people to avoid NSAIDs when they are needed and when they're indicated. So this includes those who are taking prescribed NSAIDs for chronic pain conditions, and also those of us who take it for, occasionally over the counter for management of aches and pains and flu symptoms. But I think to be sure, there are circumstances where NSAIDs should not be taken, but there is also no strong evidence that it needs to be avoided in the general population, including those who have COVID. And then to the question about NSAIDs, ARBs and ACEs or certain blood pressure medications. Early in the pandemic, there was some speculation that those could increase their chances of catching COVID and then the mortality that might be associated with it. But with the growing body of evidence now, about 9 months out, we know that that's not true. And so you should continue taking your ACEs and ARBs to control your blood pressure.
Great, Jen. Thanks very much. So bottom line is Advil, Aleve, ibuprofen, naproxen, over-the-counter NSAIDs. In terms of the COVID risk, not a concern. And for goodness sakes, don't not take your blood pressure medication because of the fear of COVID. It's important to keep that blood pressure under control now more than any.
You got that right, yeah.
Right on. Hey, a shout out to Corrine, Nurse Corrine. Everything's closed down. Is Crowfoot closed for business? I mean, what's happening? Can patients still expect to get support from their medical home?
Yes, absolutely. So we certainly understand that people want to be safe right now, limit their exposure, things like that. So, but yes, we are here to support you and we are here to care for you safely. Definitely, we are still encouraging people to call us first if you need something. We have a whole team. We have a variety of care options available. We're offering virtual phone appointments wherever possible. So that includes with your physician, nurse practitioner, phone assessments with registered nurses like myself, as we usually do. Our MDT, our multidisciplinary team, including our pharmacist, behavioral health consultant, I believe, are also, continuing care by phone wherever possible. So we definitely have those options available wherever we can. We also have Bright Squid, our secure email system. So that's another way that we can share information, aids to be able to carry through those virtual appointments. And if you do need to be seen in person, be assured that our clinic is taking the utmost precautions to keep everybody safe. So we have rigorous disinfection procedures. We're wearing personal protective equipment to keep ourselves, keep you safe. Anyone coming into the clinic, including our staff, are carefully screened for symptoms and for risk exposure, so we can really take the proper precautions to limit any risks. So we are safe, we are open. We encourage you to call if you have any questions, concerns about, how we can best care for you. Please call your team. We're happy to talk to you more about the options to best support you.
Yeah, great words, Corinne. And I think that one of the cool things about being part of the CVFP team is we have such a breadth of team members and experience, and there's lots of resources out there. I just want to address an issue that Craig brought up, and I'll give the question and then answer it as well. Craig said, look, I have a family member and their family doctor. It's business as usual. You can come in for your physicals, you can get your blood work done. And we know that there's different interpretations of the guidelines by different practitioners. I can assure you that the guidelines that are put out by the College of Physicians and Surgeons of Alberta, our regulators, Crowfoot Village is following to the T. And the decisions that we make around access start with what's best for the patient, what's safest for the patient. We try to be as flexible and as patient-centered as we can, but the safety of you, the safety of our staff really dominates our decision-making. We've done some very creative things. Corinne mentions Bright Squid. I have seen more very interesting body parts and moles that have been sent to me by that secure email. And you know what? I know what a lot of them are. So we've been doing that kind of stuff really to prevent patients from needing to come to the office, either to be inadvertently exposed or if they're asymptomatic carriers, exposing our staff or other patients. So Craig, hopefully that centers you in terms of the philosophy of Crowfoot and where our starting point is. Yan Yu, who is not just on the front lines here at Crowfoot, but also does some work in pediatric mental health. And as we were having a discussion before tonight's teleconference, we recognize that the pediatric mental health issue is a real concern right now. Yan, can you share some of your observations about that?
Sure, Rick. Thank you. Can everybody hear me?
Loud and clear, man.
Perfect. So as Rick said, yes, I do work at the Alberta Children's Hospital emergency department, and I specifically see children and adolescents coming in with very serious mental health issues. I've been doing this ever since I entered practice, and so about 3 years now. And I have to say this year, we're seeing double or triple the number of patients coming in with suicidal thinking, with exacerbations of their chronic mental health issues, or with new mental health issues that they've never talked about before, but just things are breaking down at home and life for them. Frankly, it's quite heartbreaking. On Remembrance Day, for example, it was a 24-hour shift I worked, and I did not rest even for meals. Like I was working as I was stuffing food in my mouth. There were so many patients, and I think it says a lot about the state of worry that everybody is in. But I would also say that if you're feeling like things are tough at home right now for you guys, number one, know that you're not alone in this. And number two, there are resources out there for you. So, your family doctor, myself included, we're all here to help you. Definitely give us a shout if you have any thoughts about anything that you don't want to. Okay, thanks.
Thanks, Yan. And just hearkening back to some of the wisdom that Vanessa gave us, particularly around children, is that important to maintain a safe and a secure environment at home, and try to remove that fear and try to make that Christmas as normal as possible for those little ones. I know, just a tangential comment, when I'm seeing my newborns, it's amazing how the mask impacts the interaction that you have with the newborns, and I'm just not getting as many smiles and giggles. So I'm blaming it on the mask, not that I've lost my touch with little kids. Hey, let me call on our designated import, Dr. Ian Johnson. Ian, you have a pipeline as to what's going on the other side of the pond. Your home state got the vaccine before anyone else in Britain. What are you hearing from your sources? What's happening in the UK right now in the COVID space?
Yeah, thanks, Rick. I guess I would actually just start by just echoing something Jan just said. I was just, as he was talking about, this hellish 24-hour shift. I worked in hospital care in the NHS for 9 years before I moved to Canada, and there was no quiet day. It was always busy, and this has just taken things to the nth degree. Everyone is just so busy all the time with really sick people. Whether it's people that have stayed at home too long with their non-COVID illness, or folks that are being admitted with COVID, where we have limited things that we can do to help them. I spoke to one of my buddies a few weeks ago, like probably before our numbers started to ramp up, and yeah, they've just been so busy. I haven't actually managed to reach out to anyone since the vaccine started to appear there the last couple of days. So specifically to your question, I'm not sure how that's really impacting things. I think the simple answer is it probably hasn't really changed much yet, because we still, I think one of the webinars we had recently, someone quoted Winston Churchill. This is the end of the beginning. We're no further along than that. So there's still a long way to go here. And so we need everyone to just continue with the public health guidelines. I felt like a total killjoy when we were doing these things in the spring, the captain of the fun police. But it's, much as I wish I was going to be able to see family for Christmas this year, I'm actually grateful I'm going to get to see them for Christmas next year, because we're going to keep everyone safe. Not sure if that answers your question.
Ian, it answers it really well. And, we brought Jia Hu in just to protect your reputation, to say that there was somebody who could paint an even darker picture than you did when we did this in the spring. So I'm going to start with Dr. Erin Gore-Hickman, and I'm going to just maybe ask the panel that are online for one quick salient suggestion that you would give people to be able to get them through these difficult COVID times. Again, Erin, what is the one piece of advice or the one thought that you'd like to leave the audience with in the last 4 minutes of our chat?
Absolutely. I'm going to echo Dr. Chong. So I loved the permission to feel your feelings, and call your family doctor to kind of come up with some self-soothing strategies. I love that. So that's my quip for sure.
And hey, speaking of Vanessa, I see that she may be still online, and you've given us tons of wisdom already, but what one little pearl would you like to leave us with?
I'd actually like to add something that I didn't mention earlier, which is the importance of compassion. I think it's important to be compassionate for yourselves right now. You're not going to be your best, that's okay. And also compassion for others, because they're not going to be their best either. We just need to get through this together and be patient with each other, and it will pass.
Thanks very much, Vanessa. And that compassion is so important, and especially during the times that we're all having. Corrine, what one piece of great wisdom and that you have to share?
Oh gosh. I think right now it's just remembering that we can still all be here for each other. It's just in a different way right now. And that's okay.
That's really good. My inside voice was expecting a nurse to say, wash those hands of yours. But no, I like your answer better than my inside voice.
That was my first inside voice too.
Jennifer Lamb, over to you. What do you want to leave our medical home with?
I think in times of these, as Dr. Chong and Vanessa had said before, that there's a lot to be grateful for. And so I guess I would encourage us to be joyful in hope and patient in our afflictions, whatever we find ourselves afflicted with, that there is still hope.
Good word. Yan Yu.
I echo what everybody has said so far. If there's one thing that's COVID has thrown off for all of us, it's our daily routine. So I would encourage everybody to wake up at the same time every day, regardless of whether it's a weekend or a weekday. I know it's going to be unpopular saying that to some people, but wake up at the same time every day. It'll help you reestablish your daily routine and try to get at least 8 hours of sleep every day. You'll feel a lot better.
Great advice. And my inside voice is saying, my wife Cindy and my cat Pippin are watching, and I really want them to hear that. Pippin, none of this sleeping in stuff. Up at 8 with the rest of us, buddy. I'm sorry. Ian, your last bit of wisdom.
My last bit of wisdom. I think that there's still a lot of positives that we can take from the situation we find ourselves in. And, you know, I think a lot of the things in Vanessa's, you know, COVID tips for Christmas kind of work for any Christmas, really. And that was why I was so pleased that she was able to come along and share that presentation with our patients. And, you know, so come back and look at it again next year. You know, be kind to each other. Don't be afraid to reach out to us at Crowfoot, no matter what it is that's going on. I've had too many people that have waited with things that they really should be in hospital for, who were too scared to go to hospital. And you don't need to be scared to go to hospital. The hospital is a safe place to go. I've got friends that work there and are taking enormous precautions to keep everybody safe. I don't have the data to back this up, but I honestly think it's probably safer to be at Foothills Emergency Department than the local grocery store right now. So yeah, I want you all to have a really Merry Christmas. It may be different this year, but it doesn't mean it's not merry. And we're here for you at Crowfoot if you need us. Okay.
Thanks, Ian. And I've used that line about the safety of our hospitals. I know I've got a couple of patients who are looking at elective surgery in the next week and are very fearful. And I reassured them that get in there and have those joints replaced. You've suffered long enough. So I'm going to give my little bit of final thoughts before I say thank you and bid everyone a good night. You know that this is a really difficult time in terms of our normal Christmas routine. We had a web conference with our two boys and their partners last night, and my wife, and we're talking about what our plans are at Christmas, and they really blew up after the recommendations that came out. And I was sort of saying, well, you know, I mean, technically we could probably do this, and technically we could probably do this. And my lawyer son said to me, Dad, that's sort of stupid trying to bend the rules when really the rules are there about trying to keep everybody safe. And I sort of hit my hand against my head and I said to myself, my lawyer son, who's being paid to look for loopholes, is saying to his physician father, who's supposed to be about patient safety, Dad, get with the program and follow the rules. It was a tough pill for me to swallow last night. Unfortunately, I think it's medicine for all of us. So those are my final words. Last slide coming up. And that is really just to acknowledge the people who have donated their time and their energies. We truly have, I think, you know, with Vanessa, Mike, and Jia, just have, you know, healthcare professionals who are dedicated, who are just leaders, and to have them Speaking to 1,500 of our closest friends has been a real honor. The CVFP team who have joined tonight, and those in the background, Meredith and Trevor, who have made the magic of webcasts mostly come true. Oops, Trevor, I can see behind his mask, there's a little flushing. But most of all, I'd like to thank you, our patients. The commitment that you have to Crowfoot in our medical home, taking the time tonight to hear our wisdom, the positive feedback that you give our hardworking staff at the front end helps us energize and do the things that we love to do. Thanks, everyone. Happy Christmas. Hopefully, future webcasts will have a much happier tone, but we'll get through this.
Okay, we're out.